Thank you, everyone, for the opportunity to share with you some information about my school, the School of Speech Language Pathology and Audiology. Jenna Day is the best contact for you if you have questions. She is my undergraduate coordinator, and her email address is jday@uakron.edu. She's not available today, so I'm subbing for her. I'm Dr. Jim Steiger, the school director and professor of audiology. So you have advisees who are interested in healthcare, no doubt. And often to them, that means doctor or nurse. And I would like you to have two more options for them: speech language pathology and audiology. So this might be the most important slide. I want to take a little bit of time on this and give you an idea of what professionals do in speech language pathology and audiology. In speech language pathology, we assess and treat adults and children with various disorders. One is language disorders, and I want you to imagine, God forbid this happens, but if you have a stroke or a head injury, a traumatic brain injury, and as a result, you can't understand language. When someone speaks to you, they might as well be talking French or Arabic or Chinese. It doesn't make any sense to you. You've lost your language center, damaged for some reason. And or you're not able to formulate language. You might be able to think that you want a pizza. And now you would say, hey, would you like to order a pizza? But what if you can't find the words? Perhaps you can find the words, but you can't put them together into a sentence, depending on how bad the situation is for you. We help those people. We help them to relearn how to use language to the best of their ability. When someone has a significant problem, we have what's called alternative and augmentative communication. And a good example of that is a scientist who passed away recently, Stephen Hawking, who had ALS, and he couldn't speak, couldn't do much of anything, except he could look at a computer screen, and by calibrated eye gaze, he could pick out various words, and he could put words into a sentence, and the computer would speak for him. We have a clinic, we have a lab, and we have a certificate, and it's a very sought after certificate. Some people have voice disorders, maybe because they sing or they're coaches and they yell a lot, and their vocal folds, or what we incorrectly call vocal cords, are damaged and their voice quality is affected. Fluency, which we would colloquially call stuttering. Articulatory and phonology disorders, we're basically talking about the everyday kind of things that happens in any grade school where kids are taught to speak more clearly. Not listed here is swallowing disorders. We sort of serendipitously, as a profession, got into swallowing disorders because we know the anatomy and physiology. And some people might have a stroke or other condition which affects their ability to swallow, to eat and drink. And we would work with the radiologist to take imaging of the mechanism and then provide therapy to help them to learn to swallow again. Audiologists, of which I am one, are more on the receiving end of communication. So we deal with hearing, and one way to think of it, it's simplistic, but if you think of what an optometrist does, we're familiar with that. We Optometrists will test vision and give glasses. We test hearing and give hearing aids. Um, we have also sort of serendipitously got involved with balance disorders because we know the anatomy and physiology. And so people with balance disorders go through a series of tests that we would do for them. And we even have some therapies for certain patients that will help them improve their balance. Also not listed here would be tinnitus. People with hearing loss often have tinnitus, sometimes pronounced tinnitus, or in everyday language, ringing in the ears. For many of us, if we have it, it's no big deal. For some people, it's debilitating, and we evaluate and treat those patients. So that's a very brief, very quick overview of it, and certainly I'm available for any questions or more clarifications on any of that. But it's very important. Our general area I would call communication disorders. In many universities, we're housed in the Department of Communication Disorders or the School of Communication Disorders. We call our school more directly speech language pathology and audiology. Either way, what's important for you to realize is that communication is the essence of what it means to be human. Basically, all animals, all species communicate, but not like we do. And you can't really be fully human unless you're communicating with other human beings, other loved ones. And you would only know the full effect of losing communication abilities is if it happened to you. To lose the ability to express or to receive information. Well, the good news is that we have 100% employment. I would like to brag that it is my school, but it's the profession. These quotes you're looking at are from the Federal Occupational Outlook Handbook from the Bureau of Labor Statistics. Employment of speech-language pathologists is expected to grow 21% from 2014 to 2024, much faster than average for all occupations. For audiology, it's 29%, much faster than average for all occupations. One reason that the Bureau gave is that baby boomers are growing old and they're having strokes and hearing loss, and they need to be treated. And what a rewarding career. I've been in this for over 30 years. It's fantastic. I work in a hospital. I used to work in a hospital. Obviously, I don't now. We wear scrubs, white coats. We're working right alongside physicians and physical therapists and everyone else, nurses. We're part of the team. And routinely, magazines like Time and US News and World Reports rank our professions highly. The jobs are there. It's perhaps a less stressful job in a way because we're not dealing with blood or surgery or medicines. How does one of your students become a speech language pathologist or audiologist? You have to pick one or the other. It starts with applying to the university. Direct admission to the College of Health and Human Sciences, is given with a high school GPA of 3.0, an ACT of 22, or SAT of 1030. But if one of your students does not have that, they can be a pre-admit student. I don't understand the term, why that term was chosen, but no matter. If you have a student that doesn't meet that criteria, but maybe they had a bad year or something happened, they have the potential. they can still become speech language pathologists and audiologists. Without direct admission to the college, they might not be eligible for certain scholarships, but they can still come. They can be admitted eventually to the School of Speech Language Pathology and Audiology when they acquire 30 credits, GPA of at least 3.0. They got to prove them. They can prove themselves then if they didn't in high school. Statistics, the courses would be stats, human anatomy and physiology, psych, and intro to disorders of communication. We have 2 degree options, the bachelor's degree, 2 undergraduate degree options. The bachelor's degree requires 14 credits of a modern language, Spanish, German, French, Italian, or American Sign Language. But more and more, I would say at least 2/3 of our students are earning the tagged degree, BAT, tag. And that simply means in lieu of a modern language, the students will take 13 credits of other things, not language. And we try to get some things within the college, some courses that will help our students because they work in the hospital alongside nursing and dietitians and others, psychology. And so those are the kind of courses that we would direct students toward. Of course, online, you can get a more full reading of the requirements for the BA or the BAT. There's going to be coursework in anatomy, physiology, physics or chemistry, probably physics, maybe physics of sound, psych and social and statistics. There are things that are required for the American Speech Language and Hearing Association accreditation, which we have. There's the general ed requirements. There's the foreign language, if chosen. There are core speech pathology and audiology credits, 46 of them, electives. And then finally, we have a course in which the undergrads will be able to observe. And we are about to roll out the ability for them to actually get involved in clinic. We were going to roll it out. COVID-19 hit. We didn't. We will soon do so. Which gets us to maybe the bad news, which is that you cannot practice in speech pathology or audiology without a graduate degree. You cannot be licensed. You cannot practice. That's hard for students because they think, gee, that's a long time. And I know for a young person, a year feels like 10 years. And I tell them at some point you're going to be 25, 26, 27 years old. And you can either be 25, 26, 27 years old with this degree or without it. You can have one of these jobs or not. And if this is what you want to do, then you should pursue it. The speech pathology degree required for practice is a master's degree and then a paid clinical fellowship year. Students usually earn about 40,000. I've seen more, 60,000. I've seen less in that clinical fellowship year. It's sort of your entry level position. And then when you get hired as a speech language pathologist, the Bureau of Labor Statistics says the median salary is mid 70,000. But we have to realize there are many, by the way, in our fields for historical reasons I won't go into, we're over 90% female. And so, and then for reasons, historical reasons too, I guess, many women will have children and stay home. And so, or work part-time. And that's certainly an option that affects the overall average and median salaries. In audiology, the degree is a doctoral degree, and that includes a fourth year. The fourth year of the program is a clinical position paid. Again, maybe $40,000, could be more, could be less. Um, Bureau of Labor Statistics says the median salary is mid-70s, though we know from surveys from our professional organizations, the American Academy of Audiology, the American Speech Language Hearing Association, we know that the salaries are more like mid-80s. But again, there's a lot of variability. You see on the screen that we are a consortium of the University of Akron, Kent State University, and the Cleveland Clinic. You know, our students get jobs anyway and have careers, but having the Cleveland Clinic on their resume is important. We get used to the Cleveland Clinic here in Ohio, but and we don't think much of it, but in any medical facility in Ohio or not, when people see the Cleveland Clinic on one's resume, they sit up and take notice. To speed things up a little bit in speech pathology, we do have an accelerated degree pathway program in which students can take up to 9 graduate credits at the undergraduate level. It's a course which they would do the undergrad requirements and then more in order to satisfy the graduate school requirements. And so they can save a bit of time and money by doing the accelerated program. They would simply have to apply for it in their junior year, have a 3.0, and have a faculty member vouch for them. We have a clinic, and that's where it started in 1950, and it allows our students to have the first training opportunities in-house. And we have a wide range of clinical services, which is important for your advisees to know. And by the way, for you to know, you might know someone who needs a hearing aid, needs therapy for speech or language. That's our bread and butter, and we need patients in our clinics so that our students can be trained. So yeah, and also I will say that your students, if any of your students want to come and get a tour of the clinic, I'm happy to do that for you. My school stresses leadership. As an example, my program has had 4 presidents of the American Academy of Audiology. That's an amazing thing. That's an amazing fact. And we've had many students to take leadership positions in the state and in national organizations. So we strongly encourage our students to get involved in the National Student Speech Language and Hearing Association or the Student Academy of Audiology, whichever they prefer. And then they can be the historian, the treasurer, the vice president, the president. They do good things for the community, collecting money and doing all the kinds of good things that they can think of to do. And many of our students then springboard into, as I said, working with the state organizations and the national organization, and it's a marvelous thing. And so that concludes my brief overview. Please contact me if you have any questions. Here's a nice video for you to look at. I encourage you to do that, and we are going to load up on your site for you to see some places where you can get information, and you'll have this link there as well. You'll have these links, which will have 1 or 2 more videos. And again, please, if you have any questions, please contact me. I am Dr. Jim Steiger, and that's me. on the lower left, pre-COVID days when I was better dressed. But again, maybe a good place to start is with Jenna Day, jday@uakron.edu. Thank you.